Good morning, Mr. Garcia. My name is Moises. I'm a student nurse, and I'll be working with you today. Before we begin, we must perform proper hand hygiene. Can I please have your complete name and date of birth, please? Do you know where you are? What day is it? We'll be doing an assessment today, head to toe. We'll begin with your head, the thorax, the abdomen, then to your lower extremities. We'll be using a pulse oximeter to monitor your O2 saturation, a stethoscope to auscultate, which is listen to your lungs, breath sounds, heart, and peristalsis, which is intestinal sounds, a BP cuff to assess your current blood pressure, a pen light to test the reactivity of your pupils to light and check for signs of JVD, and a tympanic thermometer to get an accurate reading of your core temperature. First, we clean all instruments and provide privacy. After assessing Mr. Garcia's vital signs, these were our findings. He is aware and alert times 3, BP 122/84, temperature 98 degrees Fahrenheit, O2 saturation at 97%, sinus rhythm 86, and respiratory rate 16 breaths per minute. We'll begin with your head. First, I'm going to inspect for any parasites or scalp discoloration. Then I'll palpate, feeling for any bumps or tenderness. We'll work our way down to your auricle, inspecting the helix for any redness or discoloration, the cavum concha for hearing aids discharge or earwax. Proceed to the eyes, inspecting the conjunctiva. It's pink and moist. Sclera appears white. Inspect face for symmetry. The oral cavity. 32 teeth accounted for and in good general condition. Mucosa memory pinkish red and appears moist. We're going to assess the pupils. Sir, look forward, please. Thank you. I'll be shining a light directly into your eyes to rate the pupils. We're going to be looking at them to be equally round and reacted to light. If our patient had experienced a head trauma, stroke, or CVA, we would perform the Glasgow Coma Scale, GCS. Since that is not the case, we can omit this section. We elevate the head of the bed at 45-degree angle, ask the patient to turn the head to the right to look for signs of JVD, or jugular vein distension. Now can you please turn to your left? Ask patient if it is okay to remove their gown. We're looking at the anterior thorax. First, we'll inspect for any discoloration, bruises, signs of surgery, or any lesions. After inspecting thoroughly, we begin by palpating, moving horizontally, checking for any signs of tenderness, pain, or masses. After palpating the anterior thorax, we'll listen to breath sounds. Every time you feel my stethoscope, please inhale and exhale. Okay, Mr. Garcia, after auscultating your lung sounds, we'll now move to the cardiac valves. The first one we'll begin with is the aortic valve. That one is located in the second intercostal space to the right of the sternum. We will now proceed to the pulmonic valve. That one is located to the left of the sternum, second intercostal space. 2 intercostal spaces below that, the fourth intercostal space, also to the left of the sternum, is a tricuspid valve. And lastly, we'll listen to the mitral valve. That one is located at the mid-clavicular line, fifth intercostal space. That one is the apical pulse, or the PMI. We will listen to that one for 1 minute. After auscultating the sounds of the anterior thorax, we cover our patient and proceed with our assessment. Now I'll proceed to the upper extremities. First, we'll check the replenishing of the vasodilation. Good. Then we check for range of motion and symmetrical strength by having the patient squeeze our fingers. We inspect the posterior thorax for any signs of redness, lesions, or discoloration. Check for symmetry bilaterally, no signs of kyphosis or scoliosis. Now we proceed to the lung sounds. First we warmed up our stethoscope, and now avoiding the scapula and the spinal cord, we hear in different landmarks. After completely assessing the lung sounds from anterior and posterior thorax, we're able to determine the sounds are strong and clear bilaterally, no signs of bronchi, wheezing, or crackles. Next, we'll look at the abdomen. We'll be exposing the area we'll be working with, which is from the diaphragm to the pubic symphysis. We'll be inspecting for any discoloration, distension, notable scars, or surgeries. We'll do so bilaterally and symmetrically. After thoroughly inspecting the abdomen, we'll auscultate for peristalsis. First, we warm up the stethoscope. Listening from the right lower quadrant, moving our way up to the right upper quadrant, then to the left upper quadrant, and then down to the left lower quadrant. Sound should be heard every 5 seconds. After auscultating, we will palpate the abdomen. We will take the same general direction, beginning from the right lower quadrant, working our way up to the right upper quadrant, to the left upper quadrant, and then to the left lower quadrant. As we palpate, we're feeling for any tenderness, masses, or pain, or any discomfort that the patient might feel. After palpating the abdomen, we will percuss, also taking the same direction, from the right lower quadrant to the right upper quadrant, left upper quadrant, left lower quadrant. As we're percussing, we'll pay close attention to the sounds. The top upper quadrants should be tympanic, and the lower quadrants should be hollow. After assessing the abdomen, we may proceed. First, we cover our patient, and then proceed to the lower extremities. Also note safety, raising up the rails. We'll now inspect the lower extremities. Feeling for temperature as we inspect for bruises. We also inspect for edemas and swelling by pressing gently on the calf area. If the skin remains indented, it is an edema. If it rebounds, it is swollen. We check for the posterior tibialis pulse, strength bilaterally, and the dorsalis pedi. On the lower extremities, we're also checking for the range of motion and the strength. We're going to have the patient plantar flex against my hands. When we're done, we'll cover back up patient to ensure comfort. I'll also leave you a call light. If you need anything, just press the red button. I'll be over quickly. Thank you for your time and cooperation with the assessment. I'll go now to chart my findings. I'll be back in 1 hour. Perform hand hygiene.